High Heel Circle, quick shout out, Dr. Joel Kahn at the Kahn Center for Cardiac Longevity in suburban Detroit. Coronavirus, just a couple minutes. I'm a heart doc, but we all have to understand coronavirus. It has nothing to do with the beer from Mexico I just discovered, but that's just a little aside. Coronavirus coming out of Wuhan, China. Couple of theories. One, it might be that there's a secret research lab there. There is, and it might have leaked out. That's a concern. That was established in 2015. It may be that people are eating in a seafood market, and there may be contamination in the seafood market. That's been published now. It may be that people are eating unusual foods for us, like bats, and it may be coming from that source. Of course, bats can have viruses like rabies. At any rate, we know there are tens of thousands of people who have been infected with a virus related to the SARS outbreak of over a decade ago, but it's a brand new strain and version of the virus, the coronavirus. Corona means crown. That's why we call the heart arteries the coronary arteries, because they're a crown over the heart. At any rate, there is a concern that more than 100 people have died. In a research publication this week in a very prestigious medical journal called Lancet, they're describing in exquisite detail, in fact now there have been dozens of research papers published this week, but exquisite detail on, I think it's 41 people with this particular syndrome: cough, fever, respiratory distress, pneumonia. Many have to go to the intensive care unit. About a third of these patients had to go to the intensive care unit. 15% died, and they do think there's a chance that transmission between humans may be as high as 85%. The person next to you has coronavirus, your chance is better than 50-50 you're going to get it. Whether that's spread by coughing, touch, breathing, and all isn't clearly known. That's all being worked on. What do we do? Because there's only 5 cases in the United States. There was a hopeful comment out of China today that they think this is going to peak in the next 10 days and start to go down. They're taking drastic measures throughout China to control this with masks and temperature and limited travel around Wuhan, China. This is creating a real concern for a lot of global businesses like in Detroit, Ford Motor, General Motors, and such. You can get good sleep, you can hydrate, you can eat healthy and avoid sugars and added fats and processed meats and such. You want to make sure you know your vitamin D level or have a good vitamin D level by either eating mushrooms, healthy foods, or supplementing. You might want to look at taking additional immune boosting agents. I'm into dried mushroom capsules. There's one called turkey tail capsules, one called cordyceps capsules. They may help support a healthy immune system. A lot of herbal teas would be a good idea. A lot of herbs in general, rosemary, thyme, oregano, and such. They're all good for your immune system. And you want to be a little careful about being out and about. Now, my next plane trip is on Saturday. I'm thinking about bringing a surgical mask with me just in case anybody is coughing. I've never done that, but this is 2020. This is coronavirus, and we need to be a little careful about that. Great hand washing techniques too. I hand wash between every patient here at the Kahn Center. All right, hopefully we'll hear in 10 days that we're starting to see a decline in cases. I hope, because it's very hard to treat viruses. All you can do is support people through them. Have a good, healthy day.